Hello, welcome to Path 300, Entry with Contacts and Services. I'm your trainer, HMIS Program Specialist, Shantae Smith. During this training, we'll be working within the system to enter a client that is being outreached using the Path workflow, as well as how to learn how to enter services provided to our client. Please note that if you have any questions, to contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Before we begin to work through the process of entering a client into the system, let's discuss a few important points that will help you with the Path workflow within the HMIS system. These points will not only help in guiding you through the Path workflow, but they are also extremely important things to remember because this can affect reporting for Path projects. First, ask yourself, where did the first contact take place? Was it during actual street outreach, or was it in a service setting such as a shelter or drop-in center? Contacts that take place during street outreach must be recorded in a separate Path project from those contacts that take place within a service setting. Then, determine which Path project to use for the potential client's entry based on the answer to the question above: Path outreach, street outreach, or Path inreach within a service setting. An entry should be created in HMIS at first contact with the potential client, along with the contact date on the client record. All potential Path clients must have a disability type of a mental health problem documented on the record immediately, even if it is not yet confirmed. A service and/or a referral is documented at each contact or interaction. Each contact date thereafter should be recorded on the client record via interims. All services and referrals should continue to be documented as they happen. Once the client is engaged or ready to be enrolled in Path, an engagement date is entered on the client record. Engagement date is recorded on the client record via interims. All services and referrals should continue to be documented as they happen. If a client becomes engaged at first interaction, record first one contact date and then an engagement date on the same day on the client record. After engagement date, all Path client record data quality standards apply in HMIS. The enrollment and Path date should be documented on the client record on or after engagement date via interims. If a client is found ineligible for enrollment, document in the client record and exit the client from the Path project. Clients should be exited from the Path project when 1. They are found ineligible or decline services, 2. They become housed, or 3. They lose contact with the Path case manager for more than 6 months. Now that we've covered those important points, let's get started. Once you log into the system, go to the top right-hand side of the screen and enter into the proper Enter Data As mode. This is where you will decipher whether your client is in InReach or Outreach. For this purpose, training purposes, we will go ahead and say that we are working with Path Outreach. Just keep in mind that this is determined based off of where you first met your client. Next, you will get into backdate mode if applicable. For this example, we will enter into backdate mode as of August 1st of 2015 to show a progression of our client. To do so, once I click on backdate, this box appears. I will go ahead and use this blue circle with the arrowhead and click it to clear out the date. Then I will go ahead and manually type in August 1st of 2015 and click Set Backdate. Next, you will go to the menu bar and click on the Client Point button. If you remember from HMIS 100, the Client Point button is the module you will use to begin your client search within the system. As a Path Outreach worker, it is very common for your client to provide you with the nickname or code name when you're meeting them for the first time. It's okay to list the name that they provide for now. We say this because you're able to change their information at a later time. For example, I went to the Walmart parking lot to outreach with potential clients. I came across a gentleman, and after a few months of conversation, a few moments of conversation, I determined that he may possibly be SMI. I began to gather some information on him to build a rapport. He tells me that his name is John, but refused to provide me with his last name. So for data entry purposes, I will list his first name as John, and then I will list his last name as the Walmart parking lot. Then I will have to complete his name data quality. You have the option of a full name reported, partial, street name, or code name reported, client doesn't know, client refused, and data not collected. Since John did not provide us with his first and last name, only with his first name, we're going to say that this is a partial, street name, or code name reported. Just keep in mind that I will list his last name as Walmart parking lot. That way I can easily identify him within the system. But I will keep track in the back of my mind that I will update this information as soon as he provides me with his full name. So, as required by my project, I will fill in as much information on the client search screen as possible to facilitate not only good results in matches, but a new client record creation. So John doesn't feel comfortable giving me his social security number, so I leave it blank, and then I will complete the social security number data quality. I have the option of full name report for social security number reported, approximate or partial social security number reported, client doesn't know, client refused, and data not collected. Again, since John did not feel comfortable providing me with his social, I will use one of these options. Keep in mind that client doesn't know literally means the client does not know the answer to this question. Client refused means that the client refused to give you this information. Data not collected translates to you as the interviewer did not ask the question. We will use client refused because, again, John refused to give us his social security number. Keep in mind that those three options are available for use. Client doesn't know, client refused, and data not collected, but please just try to use them sparingly. John does tell me that he is a U.S. military veteran, so I answer the question as yes. Once I have this information correctly listed, I will click on the search button. Once I click search, down at the bottom of the screen, the system tells me that there are no matches. This means that this particular client and name does not currently exist. So my next step is to add him into the system. I do this by clicking Add New Client with this information. Once I do, a warning box will appear, and this is basically asking if you're sure you want to add this new client, and by clicking OK, you are consenting to it. As a side note, if you perform a client search and see a client name and information that closely resembles the one that you entered down here below, and you're sure that it's the same person, use the existing client record. Do not create a new one. But if you notice that there are some differences, go ahead and create a new client record. Then once we're able to determine it is in fact the same person, the HMIS team can merge the client profiles into one. So from here, once you've clicked OK, you'll be directed to what is called your client record. On the top left side, you will see a set of numbers inside parentheses. This is your client's HMIS ID number. You can use this number to identify them within the system or by their name. Below that, you will see tabs, and each tab has a different function. When you create your client record, it will sometimes default to the client profile or the client summary tab. So Find the Client Profile tab in the event that it did not default and click it. This first box you will see is the client record. This is where your client's name and social security number and veteran status can be edited by using this edit pencil to the left of where it says client record. Below the client record, you will see a box titled Client Demographics. This is the area where you will see your client's basic demographics populated after you've completed the information on the entry assessment via the EntryExit tab. Please do not edit, add, or delete any information from this box. The information will always be populated from the entry assessment via the EntryExit tab. Next, you will see Arizona Client Notes. This is a section where you can enter in all client or progress notes or case notes on your client. Underneath is Client Notes. This is not used, so please don't enter any information here. Next, you will see an area called File Attachments. This is where you can upload scanned documents such as birth certificates and ROIs. Then you will see Incidents. Incidents is an optional way of communicating about client disagreements or guidelines, or max stay allotted within the project. If you scroll back up to the top of the screen, you will see the next tab called Households. This is used for family groupings to connect the household members together with a household ID. Then you will see the EntryExit tab. This is where all client entry and exits are recorded within your project, as well as contact dates, date of engagement, and assessment data. We will come back to this tab when we're ready to begin to enter our client, John, into our project. Next, you will see Case Managers. This is where specific case managers can be assigned to a client electronically. Before entering your client into your project, you must add yourself as a case manager for this client. To do this, you will click on the button that says Add Case Manager. Once you do, a box will appear and you will find the blue radio button that says Me and click it. All of your information will automatically populate to the appropriate fields, and then you will click Add Case Manager. I'm sorry, technical difficulties. Here we go. Again, you will go ahead and click Me. Your information will populate, and then you can click the button that says Add Case Manager. It will take you back to the Case Manager screen, and you will see your name listed as the Case Manager. Once you are no longer working with this client, you will click on the Edit pencil to the left, and the box will appear with all of your information in it, so you can list an end date and then click Save Case Manager. Next, you will see Case Plans. This is where goals can be set and case notes can be added if your agency uses this option to the client record. Goals can be printed and signed before adding to the client's paper file. Measurements. This is where you'll be able to add in SPDAT information for case management purposes. Then, service transactions. This is where all referrals and services can be recorded for this specific client, and a history of such can be viewed. Service and referral tracking in HMIS are required of PATH teams. We will talk more about services later on in this training, and referrals are discussed in the PATH 302 section. Now that we're familiar with the functions on a client profile, let's continue working with our example client, John, and move through the PATH workflow requirements of entering him into our project. From here, I would like you to click on the button for client information and then locate the EntryExit tab. Let's do a brief recap. On August 1st of 2015, we went out to the Walmart parking lot and became Let's do a brief recap. On August 1st of 2015, we went out to the Walmart parking lot and came across a gentleman who we later find out whose name was John. John wasn't comfortable enough providing us with his last name or social security number, but he told us that he was a U.S. military veteran and a story about his past. During the conversation, I assumed that John is SMI, but found out it isn't documented yet. So I've committed to helping John get his disability documented and to getting him connected with proper services. I've already created his client record, and now it's time to enter him into my project as of August 1st of 2015, because that's the first day I met him. To begin, from the EntryExit tab, locate the button that says Add EntryExit and click it. Once you click it, the EntryExit data box will appear. You will ensure that the proper provider is listed, meaning this should match what you have EDA'd into. And then list your type. Please note that it will always be path, whether you are an inReach or an outreach. Next, you will ensure that the correct date is listed. Since we are in backdate mode, this should match. Then you can click Save and Continue. You will be redirected to the EntryExit data screen where you will begin to complete the assessment. At the top, this is another space where you're able to check to make sure that your correct provider is listed, as well as your entry type is listed as path. Below, you will see the default assessment as the Path Entry Assessment. Please keep in mind that this assessment has two parts to it. The top part is labeled the Universal Data Elements, and the second, or the bottom part, is labeled Path Program Data Elements. You're required to complete the contact information at each interaction via the Outreach Sub-Assessment. Until you have engaged your client, you are only required to record the universal data elements. Complete as much as you can at every interaction. To complete the contact information, follow these steps as directed. Locate the Outreach Sub-Assessment at the top of the Path Entry Assessment, and then click Add. A new outreach record set will appear for you to complete. Start with the date of contact, and in this case, it is August 1st of 2015 because this is the first time we ever met our client, John. As a shortcut, you can click on the calendar with the green check mark to auto-populate the day for you. Just keep in mind, by using this, it'll automatically auto-populate the day for you as of the current date or the date you have backdated to. Next, you will use the location drop-down list to select where this actually took place. Was it in a place not meant for habitation, service setting non-residential, or service setting residential? For outreach purposes, this is typically place not meant for habitation, meaning out in the street, a park, abandoned building, etc. The service setting options are typically used when in-reaching. Once you've listed your location, you will just notice that the start date is already listed for you, and this end date you will not complete. You would just need to click Save. After clicking Save, it'll take you back to the Path Entry Assessment where you should fill out as much information as you can that your client reports to you within the first section, Universal Data Elements. As time goes on and you build that relationship, your client will gradually provide you with all the necessary information. So, let's begin with the date of birth, using their approximate date of birth and 4-digit year. If the client cannot give you a date of birth, ask their age and approximate their date of birth year using the 0101 for month and day, and then you will need to list the date of birth type. John tells us that he's 30 years old, but he won't give us his birth date. So we just type in 01/01/1985, and then his date of birth type isn't a full date of birth reported since he only told us he was 30. We're going to say that it's approximate or partial date of birth reported. Then you will list your client's primary race and ethnicity. If you aren't sure how to define it, take your cursor and hover over it, and it will provide you with the HUD definitions. Keep in mind, if your client reports to you to be of Hispanic or Latino descent, their primary race is white, then their ethnicity would be Hispanic Latino. If your client reports to you to be of European or Middle Eastern descent, their primary race would be white, and then their ethnicity would be Hispanic or non-Hispanic, depending on if they had Spanish origins. Also, if your client does not report to have a secondary race, please do not duplicate their primary race. John reports to us to be white and non-Hispanic. Next, we will list your client's gender. We have the options of female, male, transgender, male to female, transgender, female to male, other, client doesn't know, client refused, and data not collected. If they report something other than what is listed on this list, you can use the option of other, and then please use the text field box below to tell us what other actually means. Then you have the question, does the client have a disabling condition? For this, it must always be yes, as we said in the beginning that at entry, your client must have a mental health disability documented. For the first time you're meeting your client, he doesn't provide you with much information, and that's okay. As stated before, you will continue to work with this client. The other pieces of data will eventually be collected. But before we exit out of this assessment, we must answer this question, relationship to the head of household. This question is required to be answered before exiting the assessment. And since we work with singles, the answer to this question will always be self, head of household. Next, you must scroll down and list your client's housing status. You have Category 1, homeless, Category 2, at imminent risk of losing housing, Category 3, homeless only under federal statutes, Category 4, fleeing domestic violence, at risk of homelessness, stably housed, client doesn't know, client refused, and data not collected. Since John was living on the streets, we are going to say he is a Category 1 homeless. Then we must record our disability. As stated in the beginning, we have to record our disability of mental health for our client at first contact. So to do this, you will click on the HUD verification hyperlink located to the right of the disability subassessment. Once you do, a record set box will appear where you will need to list your client's reported disabilities. After speaking with John, he says that he does not have any disabilities other than his mental health. So you can click on the blue radio button that says no. And by doing this, it answers no for you automatically for all of the disabilities. But from here, locate the mental health problem and select yes. Once you do, this disabilities record set will appear. Our disability type and determination are automatically completed for us. So we need to answer this next question. If yes, is it expected to be of long continued and indefinite duration and substantially impair ability to live independently? This question should be answered as yes. If yes, the documentation of the disability and severity on file. There are two types of documentation one can accept. The first type can be documentation from a licensed medical professional stating that this is an actual disability, or in the event that your client is the recipient of disability monies from the government, you can also take a copy of the reward letter. If you have neither one of these, the answer to this question will be no. Next, you have this question: if yes, for mental health problem, drug abuse, alcohol abuse, or both alcohol and drug abuse, how is it confirmed? You have the option of unconfirmed, presumptive, or self-report, confirmed through assessment and clinical evaluation, confirmed by prior evaluation or clinical records. As of right now, this is unconfirmed, presumptive, or self-report. Then, if yes for mental health problem, serious mental illness, and if SMI, how is it confirmed? You have the options of no, unconfirmed, presumptive, or self-report, confirmed through assessment and clinical evaluation, confirmed by prior evaluation or clinical records, client doesn't know, or client refused. As of right now, this is unconfirmed, a presumptive, or self-report. Please note that for this very first question, for mental health, alcohol, or drug abuse, you're only going to answer this question if it is one of these three disabilities. For this question only gets answered around the mental health disability. Then, if yes, are they currently receiving services or treatment? As of right now, John is not. Your start date. It does not have to be the date that the disability was actually determined. It can be listed as the date that was reported to you. Then you have a section right here to list a note on the disability if you choose. Then, is the above condition going to be long-term? This will most likely always be yes. The end date does not have to be completed, so now you can click Save. In the event that your client had more than one disability, please, by all means, list each disability. But in this example, John tells us that he only has his mental health problem. So from here, I can now click Save and Exit. Once I do, it takes me back to the screen, and I now have a green check mark to my HUD verification, letting me know that this section has been completed. From here, I will scroll to the very bottom and click Save and Exit. I am now directed back to the EntryExit Preview pane, and this is where you will see your project name, the date of entry, and the appropriate client count, meaning how many clients were associated to this entry. Next, you will need to enter in a service of street outreach. Before we started the example, I stated that you must record every contact date you make with your client, as well as at least one service transaction of street outreach. To do that, follow these steps. From here, the EntryExit tab, go to the tab that says Service Transactions and click it. You will then be taken to your service transaction dashboard. This is where I would like for you to locate the button that says Add Service and click it. Once you do, your screen will change and you will need to complete the information listed. First, check to make sure that the correct service provider is listed. Remember, this should match your EDA mode. Next, you will ensure that the start date and end date is listed. Keep in mind that these dates will automatically populate for you as the same day, or it will be listed as the day that you've backdated to. In the event that it is not automatically populated for you, please just make sure that both dates are listed. Next, you will choose your service type. Remember, this must be street outreach. You will do so by using this service type pick list. Please note that PATH projects will never go through the lookup button because this service type quick list has been specifically tailored for PATH projects. Through this list, you will locate your street outreach service and then click Save and Continue. This next screen, you will continue to edit the service that has been provided. Again, double check to make sure that your service provider, your start date and end date, and the service type is correctly listed. You have the service notes box. Please don't ever enter information here. All notes for client services provided or case notes should be recorded in the Arizona client notes on your client profile. Next, there is a path-specific question that must be answered. If it is not, the information will affect path reporting, so be sure to complete it. It is the type of path-funded service provided. You have the option of outreach, screening assessment, habitation rehabilitation, community mental health, substance abuse treatment, case management, residential support service, housing minor renovation, housing moving assistance, housing technical assistance, security deposits, one time for eviction prevention, other path-funded services. And in this case, we will select outreach. You can skip over the service cost section as well as the apply funds for service and the supporting documentation. If you wanted to set a follow-up reminder to follow up with this client, you could do so by using this section. Lastly, you will need to complete the need information. For all services provided, your need status will always be closed, and the outcome of your need will be fully met. Then you can click Save and Exit. You will then be returned to the service transaction dashboard. Now that we've completed our first entry, let's go back to the home screen and talk about how to work through our next scenario. Once you get to your home screen, you can also turn off your backdate mode by clicking that red circle with an X in the middle of it. We have completed our entry into the project for our new client, John. Upon our first contact, John didn't provide us with much to work with. Even then, we entered him into the project, listed our initial date of contact, completed some of the UDEs, Universal Data Elements, and listed our service transaction that was street outreach. Now, let's say a few weeks have passed and we've gone back out into the parking lot to find John. Once I do, I talk to him a little while longer and gather more information about him. Once I get back to my agency, I will log into the system so I can enter in the new information I've gathered on my client. To begin, I'm already in my EDA mode to outreach. So next, I will backdate to the date this interaction took place, which is August 21st of 2015. Then I will click on the client point module so that I may search for him. I remembered that I entered his name into the system as John, Walmart parking lot. And that he was a U.S. military veteran. Once I enter that information, I'll click search. Once I do, I notice that my client appears down at the bottom of the client results section. From here, I will click on his name and it'll take me straight to his client's record. From here, I'm going to go ahead and click on this star to add him to my favorites list. That way, when I continue to work with him as time goes on, I'll be able to easily access his file. Next, from the Client Profile tab, I will locate the EntryExit tab. This is because I want to list a new date of contact for my client, as well as enter in other information he provided me with. So I will locate his existing entry into my project and click on the Interim's notepad, which is located on the right. This is so we can complete what is called an interim review. Just a few tips to remember. Once you've created an entry into your project for your client, you do not have to create a brand new entry to list the new information. You would just complete an interim. Also, to make updates to your client records, you will never go through the entry to do so. All updates will be completed here within the interims. After clicking on the notepad, a new box will appear. Then I will locate the button that says Add Interim Review. The interim review record set will appear, and your provider and entry type will already be defaulted for you. Next, you will need to complete the interim review type, and in this case, it will be update. To make sure that your review date is listed correctly, make sure that this is matching what you have backdated to. Then you will click Save and Continue. You will be taken to the interim review screen to complete your assessment. If you notice, in the Select an Assessment preview pane, the Path Update Assessment is highlighted to show that it is automatically defaulted. So from here, you will just continue to complete the necessary questions. Remember, for every contact, you have to list an contact date in your outreach sub-assessment. So let's do that first by clicking Add, list our date of contact, list our location, check to make that our start date is listed, and click Save. Then I will continue to complete the universal data elements. So our client's date of birth is listed. Although John only told us he was 30 years old, he has not provided us with his actual date of birth yet. We have his primary race listed as white and his ethnicity listed as non-Hispanic. His gender he reported to be as male, and he does have a disabling condition of mental health, even though it is not yet determined. Next, we will need to complete the residence prior to project entry. This means, where did your client sleep the night before they came to your project? You have a long list of options. Emergency shelter, including hotel or motel, paid for emergency shelter voucher. Foster care home or foster care group home. Hospital or other residential non-psychiatric medical facility. Hotel or motel paid for without emergency shelter voucher. Jail, prison, or juvenile detention facility. Long-term care facility or nursing home. Owned by client, no ongoing housing subsidy. Owned by client with ongoing housing subsidy. Permanent housing for formerly homeless persons. Place not meant for habitation. And please keep in mind that this can be used if your client slept in the streets, a car, a park, or abandoned building. Psychiatric hospital or other psychiatric facility. Rental by client, no ongoing housing subsidy. Rental by client with VASH subsidy. VASH is Veterans Affairs Supportive Housing. Rental by client with GPD TIP subsidy. Stands for Grant Per Diem Transition in Place. And just note that these two are typically veteran-specific projects. Rental by client with other ongoing housing subsidy would be a rental with someone who was receiving Section 8 or they were in a rapid rehousing project. Residential project or halfway house with no homeless criteria. A safe haven, which is transitional housing for those individuals that are SMI. Staying or living with family members' room, apartment, or house. Staying or living in a friend's room, apartment, or house. Substance abuse treatment facility or detox center. Transitional housing for homeless persons. Other. Client doesn't know. Client refused. Data not collected. Since John had been sleeping in the Walmart parking lot, we are going to say that we met him at a place not meant for habitation. Then you have this question, length of stay in previous place. This question relates to the residence prior to project entry. For this question, we would like to know how long your client had resided there. 1 day or less, 2 days to 1 week, more than 1 week but less than a month, 1 to 3 months, more than 3 months but less than a year, 1 year or longer, client doesn't know, client refused, and data not collected. John tells us that he's been in the streets for the past 4 years. Zip code of last permanent address. Please specify the 5-digit zip code of the last place that your client was housed for 90 days or more. If your client cannot remember the exact zip code, then please use the last city they resided in to complete this question. There is a cheat sheet, and if you take your cruiser and hover over the question, you'll be provided with city and county zip codes. John explained that he did not remember his last zip code because it had been way too long, but he remembered that he lived in Maricopa County. We've already answered our relationship to head of household, so we can skip it. The client location. This is the continuum of care code that was assigned to the balance of state projects. There's only one option in the drop-down menu, so please be sure to choose it. Homelessness primary reason. Choose the reason of why your client has become homeless. Alcohol abuse, bad credit, client doesn't know, client not homeless, client refused, criminal activity, data not collected, divorce, domestic violence victim, eviction, fire, disaster, health, safety, in transit, move to seek work, loss of childcare, loss of job or unemployment, loss of public assistance, loss of transportation, medical condition, family or personal, mortgage foreclosure, no affordable housing, other, overcrowding or family dispute, physical or mental disabilities, poor budgeting, release from institution, release from jail or prison, release from mental health facility, substance abuse addiction, substandard housing, unable to pay rent or mortgage, underemployment, low income, or utility shutoff. John's homelessness primary reason is due to his mental disability. Next, we have the length of time on street, an emergency shelter, or safe haven. The following questions assist in determining if the client meets the HUD definition of chronic homelessness. A handout with detailed instructions on how to answer the length of time on street is attached to your training confirmation email. The first question, client entering from the streets, emergency shelter, or safe haven. Only answer yes when the client is entering directly from the streets, emergency shelter, or safe haven. The exception is if they were in an institutional setting for less than 90 days and came from one of those locations just before being institutionalized. Since John was sleeping in the park, we will say yes, he is entering from the streets. The next question, if yes, for client entering from the streets, emergency shelter, or safe haven, the approximate date started. Please note that if you answer this first question no, you do not have to answer this second question. But since we answered it yes, we must list a date of when the approximate time started. So when entering the date the client's current episode of homelessness started, you may use their current entry day into your project if they cannot remember the exact day. For example, if their entry date to your project is August 1st of 2015, but they only remember their last episode beginning in May sometime, then you can put the start date as of May 1st of 2015. For this example, John tells us that he's been there for the past 4 years, so we are going to say it's been 08/01 of 2011. Next, regardless of where they stayed last night, the number of times the client has been in the streets, an emergency shelter, or safe haven in the past 3 years, including today. This is where you're going to count the number of times the client has been homeless in the past 3 years, even if they're not entering your project directly from the streets, emergency shelter, or safe haven. You have the option of never in the past 3 years, which were only used for diversion and homeless prevention projects. 1 time, 2 times, 3 times, 4 or more, client doesn't know, client refused, and data not collected. John tells us that he's fluctuated between the streets and emergency shelters, so we will say 4 or more times. The total number of months homeless on the street in emergency shelter or the past 3 years, John tells us that he's only been in the streets and emergency shelters, so we will say that it is more than 12 months. Then we have the length of time homeless. Status documented. There are 2 types of documentation. One is called a client self-statement or a client affidavit. The other type of documentation you can accept is if you log into the system and you can visibly see on your client's entry-exit screen that they have been served by another project within those 3-year period, you can answer this question as yes. We have neither one of the two, so we will answer no. After completing all of that information, I will scroll to the bottom and click Save and Exit. Once I do, it takes me back to the screen where I can see my completed interim reviews. Then I can click on the Exit button to be returned to my EntryExit data screen. You will now notice a number 1 is listed on the Interim's notepad to notify you that you have 1 interim update completed on this client. But don't forget your service transaction. So next, you will need to enter in at least 1 service of street outreach. And in this case, we provided John with the service of street outreach and material goods. So now we will walk through on how to enter in multiple services for 1 client. From here, go to the tab that says Service Transactions and click it. You will then be taken to your service transaction dashboard. Locate the button that says Add Multiple Services and click it. Once you do, your screen will change and you will need to complete the information as listed. You will make sure that the correct provider and dates are listed. Then you will be sure that the number of services is listed as a 1. Next, you will choose your service type. And remember, this first service must be street outreach. Then you must answer your type of path-funded service provided question. Just like before, I can skip over my service costs and my apply funds for service. Now I will need to complete my need status to closed and my outcome as fully met. But I would like to document that we provided 1 more service. So to do that, I can click on the button that says Add Another. Once I do, a new box will appear that will allow me to add in another service. So again, I will be sure that my number of services is listed as 1. My service type is going to be listed as material goods. My type of path-funded service provided will be listed as outreach. I will skip my service costs, my apply funds for service, and I will go to the need information to complete my need status as closed. The outcome of the need will be fully met. Then I can scroll to the bottom of the screen and click Save and Exit. This is where I'll be returned back to the service transaction dashboard to let you know that my services have been added. Now return to your home menu because you've successfully completed a path entry, a path update, and how to enter in multiple services for a single client. Once you get back to your home screen, you can go ahead and turn off your backdate mode by clicking the red circle with an X. Now, let's walk through the ScanPoint module. Remember, this is the module where you're able to add a single service to multiple people or multiple services to multiple people for the same date. So let's say today is September 1st. I've gone out into the community to outreach some folks. I've entered all of them into the system already, but I need to apply a case management service because I set up appointments with each of them. To do that, follow these steps. First, enter into backdate mode as of September 1st of 2015. Then, go to the left side of your screen to the menu and locate the ScanPoint button. When you do, your screen will change to show the Provide Service tab. At the top, you will ensure that the correct provider is listed. Then you will use the drop-down list to select your service type. In this case, it will be Case Care Management. Next, you will make sure that your start date and end date are listed. Remember, these dates should always match. Then, complete your type of path funded service provided. You will use the drop-down list to select one of the options, and in this case, again, it will be Case Management. Skip over your service cost section and the Apply Funds for Service, just like if you were to enter in a service for a single client. And then from here, we will now need to decide what clients we would like to apply the service to. There are 3 different ways that this next part can be completed, and we will complete an example for each option. Option number 1. Locate the button on the bottom of the screen towards the middle that says Start Scan and click it. Once you do, your screen will change and a box will appear with the title that says Scan ID Cards. In this pop-up box, you are able to look for your client by name or by their HMIS ID number. Once you've located the clients you wish to apply the service to, a list will be created at the bottom. To work through the different ways of adding your client using this option, let's start with the client search. You will see an arrow next to it where it's pointing towards the right. If you click the arrow so that it points down, you will expand the client search panel. This is where you can type in your client's name, and then click Search. Excuse me, technical difficulties. Once you click Search, you will notice down in the Client Results section, your client's name will appear. So to select him and add him to the list, you will have to click on the green circle with the plus sign, and then you will notice that his name has been listed down here at the Entered. Now, if you know your client's HMIS ID number and would like to search for them that way, you can do so by using the Scan Client Barcode section and typing in their HMIS ID number. And click Scan Barcode. Once you do, you'll notice that their name has been added here down at the bottom. You can continue to work through whichever way works best. We can go ahead and add one more client by searching for their HMIS ID number. But let's say that I accidentally added a name onto this list. To remove it, I can click the button that says Remove Last Entry, and it would remove the last person I entered. Or if I wanted to click on the trash can, it will go ahead and delete that service and the client from this list. Now that I have my list compiled, I can go ahead and click Exit, and it takes me back to this screen. You just have to know that the computer did its job in the background and applied that service to those clients that you listed. Once you get back to the screen, we can now look at option number 2, which is the Choose Clients from Client List button. But before you can begin to use this option, you must create a clients list in the Manage Client List section. So at the very top, you will notice the tab that says Manage Client List. Once you click it, your screen will change and it will show you previously created client lists if there are any applicable. So to create your own, you will go ahead and locate the button that says Create New Client List and click it. Once you do, a pop-up window will appear and it will allow you to name your client list. And then you will make sure that the correct provider is listed to which the client list applies to. Click Save and Continue. Once you do, your screen will change. You will see a header that says Client List. HMIS Path Trainer. This is where you will create your client list. You can do so by adding clients, typing in their HMIS ID number, or you can search for their name. If you choose to add them by their HMIS ID number, you will type in the number and then click Add New Client, and this client will be added to the list. But if you choose to search by their name or other criteria, you will click on this search box, type in the information you have, and then click Search. Once you do, a list will generate under the search results. To select the client, you will click on the green circle with the plus sign located to the left of it. It will seem like nothing happened, but in the background, the computer did its job and added the client to your list. So once you've completed searching for and adding your clients to the list, from here you can click Exit. Then it will take you back to your client list page to see who's listed. Then you can click Exit again, and it will return you to your Manage Client List tab. So from here, you will go back to Provide Service, and at the top, you will ensure that your correct provider is listed. You will list your service type as Case Care Management. Your start date and end date will be listed. Your type of path funded service provided. If you remember, skip over your service costs and apply funds for service. And then you will click on Choose Clients from Client List. Once you click on this, a box will appear of all the client lists that have been created, and to select your client list, you will have to click on the green circle with the plus sign. From here, you're able to choose which clients from this list you would like to apply this service to, whether it be all clients on your list or just a few. Since both of these clients receive this service, we're going to click the box that says Check All Clients. And then I'm going to click the button that says Enter Service for Clients. When I do, it tells me that the services were successfully entered for my two clients. And then I can click OK. Please note that option number 3, which is Choose Clients from Client List, are for projects who use the ShelterPoint module within the system. Your project does not use this, so you do not have the ability to use this option. We understand that it can be nerve-wracking not knowing if the service was applied to the client, but we can assure you that the computer worked in the background and attached the service that you, the user, has created to your client's profile. So from here, let's work on the next example of how to apply services, multiple services, to multiple clients. From the Provide Service tab, I would like for you to locate the Multiple Services tab and click it. I have a group of clients that came to me needing housing counseling and personal financial counseling. I've provided that service and I need to document it within the system. So from here, I will double check to make sure that my service provider is listed, my start date and end date are listed, and then I will begin to complete the service by making sure the number of services is listed as 1. I will list my first service type as housing counseling. My type of path funded service can be case management. Remember, just like before, I will skip over the service costs and apply my funds for service. Then I will need to complete my need status to closed. The outcome of the need will be set to fully met. And just like if I were to add multiple services to a single client, I would click on this button that says Add Another. So it provides me with another space to add my next service. So again, my number of services will be 1. My service type will now be personal financial counseling. Type of path funded service provided Need information, my need status will be closed. My outcome of my need will be fully met. And from here, I will now need to select the clients that I would need to apply the service to. I'm going to use the Choose Clients from Client List since I already have my client list created of the services I need to apply the clients to. So once I click on that button, my client list will appear. And to select it, I'll click on the green circle with the plus sign. I will select the clients that I wish to apply the service to and click Enter Service for Clients. I will then be returned to the screen where it tells me that this services were successfully entered for these two clients. Then I can click OK. From here, I would like for you to return to your home menu. To reiterate a few key points, let's look over this summary. According to the BOS HMIS Data Quality Plan, you must enter clients into the system within 7 calendar days. The U.S. military veteran question is initially answered on the client search screen, but it can also be answered on the client profile screen. When creating an entry at first contact with your client, you must go through the EntryExit tab. The first contact date and location must be recorded within the outreach sub-assessment at the top of the path entry assessment. At least one service should be recorded at each contact. Client demographic information should be gathered as it becomes available, and it should always be recorded on the EntryExit tab through the path entry assessment. Outreach teams are not held to the Continuum Data Quality Plan on completeness until the client becomes engaged, but all data gathered should be filled in and updated as much as possible until then. HUD considers the zip code of last permanent address to be where the client was housed for 90 days or more. Remember these points when completing the length of time on streets, in an emergency shelter, or safe haven section. Only answer yes to the first question when the client is entering your project directly from the streets, an emergency shelter, or a safe haven. The exception is if they were in an institutional setting for less than 90 days and came from one of those locations just before being institutionalized. When entering the date the client's current episode of homelessness started, you may use their current entry day into your project if you cannot remember the exact day. For example, if their entry date to your project is October 3rd of 2015, but they only remember their last episode of homelessness starting in May sometime, then you can put a start date of May 3rd, 2015. Next, count the number of times the client has been homeless in the past 3 years, even if they are not entering your project directly from the streets, emergency shelter, or safe haven. Only use never in the past 3 years for diversion or homeless prevention because the question says to include today as an episode. Add up the accumulated months of homelessness during the past 3 years, where the client was either living in the streets, an emergency shelter, or safe haven. Any single day or part of a month counts as one full month for this question. Each subsequent contact date and location must be recorded in HMIS via Interim updates. Interims is located on the EntryExit tab. The Path Update Assessment defaults, which also has the Outreach Sub-Assessment at the top. Again, at least one service should be recorded at each contact. When wanting to record a service to a client's profile, you will do so on the Service Transactions tab. When adding a service, the start and end date auto-populates, but make sure both are complete and do not leave them blank. The service type list can be set up for path projects specifically. So please do not deviate from the populated list by using that service code lookup button. Path projects also have an additional path-specific service type question that must be answered each time a service is recorded. The need status of a service should always be set to closed, and the outcome of a service should always be set to fully met. When wanting to record services or multiple services to multiple clients, you will use the scan point module. When using the scan point module, there are only 2 out of the 3 options that can be used by path projects. Number 1 is Start Scan. This is where you can search for the client by name and social security number or by their HMIS ID number. Option 2 is to choose clients from a client list. First, you must create a client list through the Manage Client List tab. Then you can apply the service or services to that specific list of clients. Please note that the third option, which is the unit list option, cannot be used by path projects. When wanting to review or make corrections on existing services, you will go to your client's profile and locate the Service Transaction tab. From there, you will click on View Entire Service History button. As a reminder, if you have any questions, feel free to contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Thank you, and please return back to your training confirmation email for further instructions.